Our caregivers, I think, have been very proud to serve throughout the pandemic. But I will also tell you that the load has been very heavy. And we've asked people to do a lot. And as you know, it's been going on for more than 2 years. And so I would also tell you that I think our teams are tired. Other hospitals in our region have had to curtail services either because of workforce shortages or their expense equation not working. And so we have found our hospital fully subscribed all the time. And we found our emergency room overloaded. And at times we've had to cut back on our routine surgical caseloads in order to be able to take care of these other patients. And so I would tell you that I think the challenges that we are facing today are due to really significantly increased demand at a time where the workforce, it's tough for us to hire and maintain as many people as we need to keep fully open. On the income side, we are fairly limited to increases based on contractual arrangements. And in addition, as you know, the governmental payer programs have not had significant increases, and in some cases there have been cuts. On the other side of the equation, the expense side of the equation, just like every other industry, but probably to a greater extent in healthcare, we have seen inflation of our expenses. And that's been most predominantly in our greatest expense, which is our personnel expense, partly due to premium wages, but partly due to the travelers that we have required to keep those units open that I talked about earlier. In addition, our supply expenses have gone up. And as you know, there has been some teetering in the supply chain. And so sometimes what we have to pay in order to get supplies in and get drugs in has been higher. And overall, we've seen increases on the revenue side that I talked about first of maybe 2 or 3%. But meanwhile, over the past couple of years, we've seen increases on the expense side more like 20%. And so that's put us under a great deal of strain, just like every other hospital and a hospital system in the United States. And when I look at the industry all across this country, it's clear that there are many that are caving in at this point in time. So I will tell you this, from a financial point of view, is about the worst that I've seen.